Welcome back to Primetime News.
And a special welcome once again to our viewers on onespotmedia.com.
Up first this evening, from surgeons to anesthesiologists, psychiatrists and medical doctors in pediatrics, the list is long for professionals needed to fill over 700 vacancies in the public health sector.
Now, as Shamela Pullen now reports, the Nurses Association of Jamaica wants the Ministry of Health to take the same approach to fill critical positions left by migrating nurses.
Scrolling through the career section in the Sunday Gleaner on October 15, we came across 14 pages listing a number of vacant medical doctor positions in the local public health sector. Health Minister Dr. Christopher Tufton has dispelled concerns that the positions are available because medical doctors are migrating. Instead, he explains, the Ministry of Health is trying to boost the complement of doctors already in the system.
What we're doing now under this review and reform is to put more doctors in the system, placing them in permanent positions, and they work a period of time between Monday and Sunday. So there's no overtime on weekends. It's one standard payment for a set number of hours in a given week. I mean, there will be time from time to time where they may have to do extra sessions, but we're trying to minimize that. So instead of having 5 doctors, we now have 10.
The public health sector has been plagued by many issues, long waiting times at hospitals high on the list. Just recently, administrators at the Savlamar Hospital expressed frustration as the shortage of medical doctors is impacting its service delivery. Other health facilities have a similar issue.
The doctor would do a 24-hour cycle or more. Now, in a sense, it shows the resilience of the doctor, but it also shows the flaws in the system. And it also shows how a patient's care can be compromised by a doctor who's required to be alert to provide a service over a 24-hour cycle without sleep.
The Nurses Association of Jamaica welcomes the attempt at boosting the complement of medical doctors, but it's hoping a similar approach can be taken to address the gaps left by migrating nurses.
A couple of years ago, we had a similar situation for nurses where we got over 1,000 posts for our level 1 nurses. We still have some persons who are outstanding, but that is an engagement that we will take up with the government in short order. We currently await feedback from the Ministry of Finance and Planning on some matters that we have outstanding. And we have written to them since our last annual general meeting, so we await feedback on that.
Meanwhile, the Jamaica Medical Doctors Association says there is concern about the disproportion between the number of vacant posts for consultants and junior doctors. And while the GMDA has signed off on the recent wage agreement, there are still lingering issues. The consultants have yet to sign the wage offer. Shamela Pullen, TVJ News.